Myself, Kalaiselvi, first MSW. Now we are discuss about family counseling. Family, problems of family, definition of family counseling, and role of social worker in family counseling. Also, skills of social worker in family counseling. Definition of family. A family is a group where members are related with each other through blood relation or marriage. Families go through a life cycle which takes place through marriage and the children are born. Families are able to cope with the role, transaction and stresses. Situation cause inadequacy and they seek professionals. The family faced many problems. There are refusal of family members to work, parents' refusal to support children, antagonistic adolescents, lack of resource for maintenance of family, distribution through the behaviors of its members, spouse, and parents. Definition of family counseling. Family counseling or family therapy aims to address psychological, behavioral, and emotional issues that cause family problems. Role of social worker in family counseling. Social workers help families improve relationship and cope with difficult situations such as divorce, illness, or death. They guide families through the counseling process by helping them identify problems, set goals, and find solutions to their troubles. In crisis situations such as neglect, substance abuse, or violence, they may also recommend legal action such as having children temporarily removed while the parents work through their difficulties. Facilitating communication. A social worker often begins by simply encouraging family members to communicate. Sometimes families have bravely spoken to each other for months by the time they enter counseling. The social workers acts as a neutral third party, helping family members share their fears. She often asks questions designed to help families to discover the underlying causes of their problems. For example, if a child is misbehaving, it may not be because he disrespects his parents, but rather because he is troubled by tension in his parents' marriage. A social worker would help him articulate these thoughts so the entire family could discuss and understand them. Intervention duties. Family intervention in social work sometimes requires immediate solution, even if short term, to help families work through problems or diffuse potentially volatile situation. According to the Bureau of Labor Statistics, a social worker will often attempt to stabilize the family unit, including addressing individual members' issues, so that counseling will be more effective. For example, if one family member has a serious drug or alcohol problem, the family service social worker may recommend that he enter a treatment facility before continuing with therapy. Or if one family member has a mental illness such as depression or bipolar disorder, the social worker may advise him to visit a psychiatrist who can prescribe medication to help him manage the stress. Conflict resolution. Families often enter family counseling because they have an immediate problems that are creating stress and conflict within the family. A social worker's first objective is to help families understand and solve their issues. If trouble in the parents' marriage is causing discord throughout the family, the social worker will help the couple address their issue with each other and so they can work as a team in a caring for their children instead of constantly arguing. For example, of the role of social worker in divorce, if children are acting out because they are upset about their parents' divorce or about the death of a parent or other family member, the social worker will help them find ways to deal with their grief or fear. Teaching responsibilities. A social worker's long term goal is to teach families how to work together to solve and prevent problems. In addition to helping them resolve their immediate issue, she will also educate them about family dynamics and how they impact both individual members and the family as a whole. She will help them understand how they approach problems and why the way they respond to conflict make the situation worse. She will also help them create a plan for more effectively handling conflict in the future. For example, she may recommend that they hold weekly family meetings where they can openly discuss their concerns. Next, skills of social worker in family counseling. Family counselors are mental health professionals who deal specifically with conflicts behavioral issue involving members of a family. They work with family members on an individual basis or in a group setting. Some counselors focus on resolving issues between married couples. Family counselors should possess a variety of key skills to be effective in their role. Speaking and listening skill. A family counselor must possess strong communication skill. Leslie University mentions they must be able to listen to the various points of view that family members have about issues without appearing to be judgmental and to ask appropriate questions in the process of gathering more information when necessary. Family counselors also need to facilitate the communication process between family members, particularly if they are reluctant to talk about important issues or to even acknowledge that problem excited. Perspectiveness and empathy. Each family member play a role in the family structure, so the family counselor must be perspective enough to understand varied points of view and have the empathy to mentally place himself in each person's shoes. For instance, one family member may be domineering while another attempts to be peacemaker when conflicts arise. By gaining an understanding of each role, the counselor can work to develop strategies so that she can help family member conflicts. Conflict resolution skills. Once the issue of conflicts have been identified, family counselor must help the parties achieve an effective resolution that is as satisfactory as possible to everyone involved. Counselor must be skilled at helping the parties to identify a set of possible alternatives and to weigh the pros and cons of each. When the parties finally agree on a course of action, the counselor helps them develop a plan of implementation and follow up to make adjustment if necessary. Next, instructing and leadership skill. Families that seek counseling are often confused about what direction to take to resolve issue. Counselors need strong leadership skills to develop the trust necessary to persuade family members to follow the recommended course of action. They also must have the teaching skill necessary to help the family members understand the causes of the conflict as well as the various steps in the conflict resolution process. In same cause, counselors need to teach family members how to change negative behavior patterns. Then, strong organizational skills. According to the Bureau of Labor Statistics, marriage and family therapy skills also include being a good organizer. This means being able to get everything together for your client's session so that you can best help them. In addition, good organization skill will help you keep track of paperwork and coordinate efficiently with outside parties such as insurers.